Welcome back. I hope you had an amazing dream, dreaming your ideal infertility journey. We are on to the next chapter, next module, which is Introduction to Infertility. This is where I'm going to talk, even though I'm not a medical doctor, I'm just going to give you a little bit from the medical side of the house. It's important to understand what is infertility. I'll just explain in my own terms. If you are having regular sexual intercourse for 12 months or so, trying for a child, and if it's just not happening, you may have infertility. Or, growing up, if you have a physical impairment in your body or in your partner's body, and that is not allowing you to have a child, that is also termed as infertility. I'm going to share some quick facts about infertility. Do you know how many people, let me be more specific, how many couples go through infertility? 1 in 8. 1 in 8 couples go through infertility, and that's a lot. If you're in a room full of people with 10 couples who are in that right age, having a child, there is a high chance that one of them is at least going through infertility. And majority of the time, infertility and the challenges associated with that are focused mainly on women. But it's just not attributed by women or female factor. 33%, of course, attributed by female factor. 33% attributed by male factor, and the remaining 33%, it's the combined factor. And that's where my story comes in unexplained. That's where I kind of come in, our story kind of come in. 11.9, almost 12% of the women actually go through infertility treatment in their life. That's 12 women for every 100. That's a lot. And this fact, when I learned about it, kind of really wowed me, whoa, I didn't know about this. Couples aged between 29 and 33 with the normal functioning reproductive system, they don't have any challenges or any previous issues. Do you know what's their chance of conceiving in any given month? Only 20 to 25%. I didn't know that. And that's very small percentage. And after trying for 6 months, only 60% of them get pregnant without any medical assistance. That means 40% of our population go through some kind of medical assistance to get pregnant. Why am I talking about all these quick facts? When I was going through this, I really didn't know about these facts. And many of us think that it's just us going through this dreadful, especially if it's really a hard journey. I'm not trying to minimize your situation and your journey, but these lists of facts actually gives you a perspective. You're not on this by yourself. You're not alone. There are so many people in the world going through infertility. And this is just some data points for you. This is a complex, massive problem. One of my male friend who went through infertility challenges himself told me that. That's his exact words. Pradeepa, this is a complex, massive problem that we just don't realize. You know how this world sees this topic of infertility? We don't talk about it. Shh, it's a hush-hush subject. In many cultures, including where I come from in India, it's a very sensitive subject. Let me be very honest with all of you. Until my OBGYN told me about, Pradeepa, you should go see a fertility specialist, I was naive. And I didn't know that existed, to be honest with you. It never, in my bringing, in my country, I've never seen anybody talking about it openly. Such a sensitive subject. People don't talk about this. People don't like to talk about this. Whoa, don't talk to me like that. Ooh, I don't want to hear that. And many people don't know how to talk about it, how to support when somebody is going through fertility challenges, what to say to them and what not to say to them. There is no screening for infertility. There is a big lack of awareness.